Well, Richard was the first CIO of the HSE, and he sort of brought a breath of fresh air and a whole pile of energy kind of flowing through the system, which woke everybody up. I personally think, as a peer who was kind of watching Richard from a little bit of distance, didn't think I'd end up in this role, that he actually showed us what was possible. And I've always said Richard opened a book and showed us what was in that book. And we had been quite traditional in the past, and I suppose the timing of Richard coming was at a time when the possibility of digital, particularly in healthcare, was really gaining momentum. And he developed the Knowledge and Information Plan, which is really the platform from which we want to approach everything. So he got that plan in place. So for me, it's about implementing that plan then, which he showed us. And so the plan covers lots of areas, like the building blocks to have a digital infrastructure from which we can launch a whole pile of new stuff that's possible, and really pulling on data. Data is the big untapped wealth of understanding our health services better. So that's what he did. You know, he got an energy into this place that I really want to continue and grow on. The main priority is to stabilise ourselves. We've had a lot of very exciting, innovative ideas coming forward. Under Richard's guidance, he developed the Quick programme, which is this place of fast-tracking really good ideas coming in from clinicians, etc., to get things moving. So we need to stabilise. We're kind of swamped with ideas in many ways. So we need to kind of grab that, stabilise it. Our whole kind of core infrastructure needs to get I suppose made more solid and more ready for the 21st century digital opportunities that are there. Electronic health record is we were talking about it earlier, it's really important to us, and that and the individual health identifier are the two, what I would call the linchpins, that we need to get right. Richard got them already, they're all there, launching, going through. There's a few more years of implementing the IHI. That's where the individual patient has an identifier, so we can link them through our services and through our systems. Without that, digital can't really work properly. The electronic health record we talked about, everyone's familiar with the file, medical record, when you turn up at a hospital, losing it, not finding it, pieces missing in it and whatever, and just being an awkward kind of thing to work through. That's not normal internationally. Internationally, most hospitals have got rid of those at this point, and we've been slow to go there. The maternal and newborn system was started in Cork about a year and a half ago. Huge amount of planning, phenomenal success, where they got rid of all the paper records, and everything is now linked from a digital perspective, and it's so safe. Never mind how easy it is to find, retrieve and use and all of that, but actually getting your lab tests, everything going straight into your record, it's just so much safer for the patient. So that's one thing Richard started, and since he's left, both Holles Street just a couple of weeks ago, and just before Christmas, the Rotunda went live with their digital health record. So that's really exciting, and we need to kind of move that. We've got permission on a national EHR for health, and the first implementation of that is going to be the new Children's Hospital. So that's a huge piece of work for the next few years. I think it's a huge untapped wealth of possibilities at the moment, and it kind of ranges across things from actually replacing what we do in a sort of automated way right through across to doing things totally different. And totally different, you're talking about virtual care, you know, keeping people in their homes and linking up, and we see lots of pilots internationally on that, so that's possible. But if you go right back to the basics, so things like managing our waiting lists, which is a big issue for us. I talked a minute ago about the individual health identifier. We have multiple people on multiple waiting lists, and so we don't even know our numbers correct, because lots of people will put themselves on several waiting lists just to try and keep their options up. Don't blame them when the waiting lists are what they are. So we're looking at technology to help us understand our waiting list better, and the whole data mining and getting onto that, I think, can lead us to a much slicker way of doing things. So we're looking at that. That's about outpatients, it's about emergency departments, it's all of that. So that kind of stuff, so really replacing what we're doing in a sort of an automated way, using the data to give us a much better understanding, right through to doing things totally differently. I think at every single step there are digital opportunities. talking about the Apple Watch, I mean, that's bringing us back to sort of patient empowerment, which is absolutely the way forward. We've a bit to go in some of that, but the idea that you can monitor your own health, that you can link up. You know, if we had an EHR, you would potentially have access to that, and you could connect what your Apple Watch is telling you right through to what you're into your EHR, so your doctor would have all that information when you go about something or would see it. So there's a huge amount of empowerment that's happening around the world in other countries. It's not science fiction anymore. So we need to do sort of short, medium, and long-term things to kind of go there. That kind of stuff wows me because I'm a physiotherapist, so the whole health and well-being and all of that stuff. And I think chronic disease management, there's huge possibilities. Lots of startups, particularly in Ireland, coming up with really good products that can help, particularly patient empowerment and management of their own, working in partnership then with their healthcare professions, whether it's the doctors, the nurses, and all that kind. And to me, that's a big possibility. Going back then to basics, in hospitals, other technical, everything in a hospital is now technically enabled. So it's I worked in hospitals 20 years ago. They're such a different place now than they would have been there. And every year new technology is coming out that it connects what a doctor is doing, what a nurse is doing, and making patient care much safer. I think that's the other one that we need to look at, all those possibilities. But we have an open door here. Tech companies are in here all the time. There's hardly a day goes by I don't meet them with their products. And we're looking at them. I mean, genomics is a big one, and we've supported through one of our Lighthouse projects an epilepsy program looking at genomics. That has enormous potential to improve and target healthcare in a way that we've never seen before. And that's a great use of money, save a lot of money if you can actually go right down into what an individual patient's absolute needs are instead of this broad sweep that we often do, and also brings the empowerment piece near the patient. So that's just an example. There's loads of those examples out there. There's just so many, we're tripping over them. And actually one of our challenges is to how to prioritise those and where to start with them. Absolutely, it has to continue because this is a partnership. We need them and they need us, and we probably need them more than they need us in many ways, because you know, we're a health service. We're not into developing all these snazzy technology things. We need the private sector, the startups, the big internationals, all of them to come and give us solutions to some of our challenges, and they're all out there. There's so many of them, and I think over the last few years they've really become partners with us as opposed to people trying to sell us things, and that we can jointly solve the problems. So we'll be very open talking to them about what we see as our short, medium and long-term challenges, posing questions to them. An example at the moment is, one of the things Richard did was he pursued an open data policy. So all our data is published, it's available free to anybody. And people internationally have said to me, "You're mad, you could sell that." And I said, why do we sell it when actually it belongs to the people of Ireland? And we've put it out there and said, can you, any of you out there, whether it's the colleges, the startups, anybody, do anything with this data that can help us help healthcare? And they're looking at it. We've got big companies and little companies looking, and some of the colleges looking at our data and coming up with solutions. And that's about partnership.